Hi, everybody. I was chatting with my resident this morning about one of her cases, and I thought it would make one of the themes that came up when we were chatting about this case. I thought would make a really good video that folks would be interested in. So this is a scenario where a patient was exposed to some tick bites, developed some symptoms, wasn't able to get testing done in a timely manner to look for Lyme co-infections. These symptoms had been persisting for quite a while, so it wasn't like just stereotypical Lyme disease or whatnot, and basically just started on some broad spectrum herbal antimicrobials, the type that we use all the time, with known or suspected chronic infections. Patient felt a lot better, major improvements, but then unfortunately several months later had some stressors and symptoms relapsed, not all the way back to baseline, but not feeling maybe like 30-40% relapse. And so then some testing was done to look for microbes. It was a fairly comprehensive panel running spot testing, so looking for T cell mediated immunity to a wide range of different microbes, including Borrelia and Ehrlichia, and doing serological testing for viruses. And just did a really quite a comprehensive panel, and just nothing came back. The other factor is that the patient, while waiting for these test results to come back, went back on the herbs, and we're just not sure yet how that went. So that's kind of where it was. We're having a chat in preparation for the patient's upcoming visit. So what we talked about was, if patient's feeling better from the going back on the herbs, then it suggests that there's some type of infection that we just didn't test for, or that maybe technology does not exist yet to test for, and that we're treating a little bit blind, but that's okay. The herbs are safe and well tolerated by and large, and as such, we'll just kind of feel things out. Maybe the patient will opt to do more testing, although testing is expensive, so maybe not. But that would be one. That would be the most likely explanation in that case. The symptoms relapse because not all of the infection was gone. The immune system was doing better, keeping things at bay, but then with enough stress, things kind of came back to rear their ugly head and have started to gain some ground again. The other scenario, though, that might play out is that going back on those herbs while waiting for the test results did not make the patient feel better. And in that case, how do we explain that? In that the herbs were helping before. Now we're testing, we're not seeing any microbes coming up, and again, might be missing the microbes in question, but let's just say, for argument's sake, that the test is comprehensive to the point where there's really no objective evidence of any ongoing infection, and the herbs second time around didn't help. Well, what might be going on? Well, in that case, the most likely explanation is that, and I'll just, again, for as I say in all of my videos, this is for informational purposes only. Anything I'm saying should not be construed as medical advice. If you need medical advice, please talk to your healthcare provider to get that advice. So what would be plausibly going on in that case, most likely going on, would be some type of a microbial hypersensitivity, where the microorganisms were there because patient felt a lot better with the herbs, responded quite quickly, responded quite fulminantly until the relapse. But then now there's a relapse. In this scenario, herbs aren't working now, so actively killing things isn't helping, suggesting there's nothing actually overgrowing. The labs aren't picking up anything. So what could still be going on? Well, it may be that the immune system has been put into a state of dysregulation by those microorganisms, and now there's actually a hypersensitivity component going on to things. The best analogy I've been able to come up with, is not a lovely analogy, but it's effective, I think, is that when microbes come into the body, it's kind of like some criminals coming into a big city. They start, committing crimes all over the place, and they also hypnotize the police officers in the city to become arsonists. And that's essentially what the microbes do. Lyme, Bartonella, like Borrelia, Bartonella, Babesia, Mycoplasma. These microbes, that's essentially what they do. They come into the body, they start wreaking havoc, they're damaging tissues, they're, generating, causing problems in and of themselves, stealing nutrients, what have you, but they also flip the switch on the immune system, the police officers in this analogy, and they flip the switch on the immune system to get the immune system to go into an inflammatory mode, i.e., setting fires in the body, so to speak, and not killing them off in the process. So instead of the police officers, arresting the criminals, they're just setting fires and creating even more pandemonium. So even after let's say in the scenario, like they call in the militia and they, get rid of the bank robber or the criminals that way. Well, if you're still left with these hypnotized police officers that are arsonists, that's still a big problem. Like, great, the criminals are gone. The Lyme and co-infections are gone, dead and gone. But if the immune system's still in this inflammatory mode, that's still a big problem. And so that's the type of scenario that I've seen in many cases over the course of time. And that might be what's happening with this patient. I'm going to wait and see at my Thursday morning meeting with my resident. I'll see what the verdict was and see what was going on with this patient. But that in the event that it seems that scenario number 2, the sort of hypnotized arsonist police officers, is what's going on, then the best therapy to work with in that type of case, in my experience, would be low-dose immunotherapy, which I've talked about in many videos in the past. If you haven't heard of it, please search some of my past videos, and I've talked about it. There's some with that as a title, and it's something that can be very, very effective in these analogous cases. It can help to flip the switch back into a non-inflammatory mode, and so essentially dehypnotizing the police officers so they can go back to doing the good job they're supposed to do, and not setting fires randomly. So the immune system can go back to patrolling the body, fighting off infection, fighting off cancer cells, doing all the good things the immune system is supposed to do, and not just setting random inflammatory fires around. So I hope this information was useful. If you have any comments or questions about this topic or anything else, please post in the comment section below, and I will leave it there for now.